doing today, Bianca?
We are going to be doing everything, okay? I found out the world's back open. I need it all. I need to look like 2019 Bianca.
Well, you look gorgeous. So you're coming along so nicely. And you told me that you've been doing the Accutane.
Yes.
And your skin is looking like perfection.
I'm so happy because I haven't really seen that many people. So I feel like when I come out of this thing, they're going to be like, who is she?
Right? When you take off that mask. Because I didn't even notice until you took off your mask.
Well, and then a lot of people that struggle with acne, they have like a lot of breakouts from it. And I'm like the opposite. I'm like,
exactly. And don't you love that glow your skin gets from the Accutane? I really think Accutane is a miracle, and I think Bianca's a perfect example because you've always had that little blotchiness.
Yeah, I've always had it's like all I focused on was just clearing my breakouts. So you know what I mean. I've never been able to focus on my skin in other ways and make it look, glowy and all these things and take really good care of it. Because I'm just so focused on not breaking out. You know what I mean? So this is my first time where I'm like I can actually enjoy my skin and like really like have not to wear a lot of makeup, and it's just like, you know what I mean? My focus is actually on like making my skin look really good, which is so nice.
And it does. It looks perfect. Now, one of the things I have people say all the time is I'm afraid of it. Now, did you have any fears prior to doing it, or preconceived ideas about what Accutane was about?
I think because there were so many people that were just like, don't do it. You know what I mean? I'm just like, why? I don't feel like a lot of people really like researched it for themselves. I know that obviously you can't get pregnant, but I'm like that. I wasn't trying to get pregnant. And you're not supposed to get pregnant on medicine. You just don't do it. And then the dryness of your skin was another big one. But I didn't really have too many issues. I feel like if you get the products you need for it and you really like treat your skin well and you moisturize and you do what you're supposed to do, that it's not that big of a deal.
Right. And the side effects are really minimal. So what would you say to those people who are afraid of using Accutane? Into the camera.
Are you afraid of looking at yourself in the mirror and having acne every day? That's like a bigger fear for me. If you want to have a little bit of dry skin for a few months versus like not having acne for the rest of your life and not having uncomfortable pimples and just feeling uncomfortable when you go out in public, like this is definitely the way to go. Like there's nothing that is going to be worse than that feeling of not feeling comfortable in your own skin.
Right. So I'm a big lover of Accutane, and I'm so grateful that you said that because people that are afraid of it really don't need to be afraid. So, because this medication has been around for so many years. I love Accutane, and I'm so glad you gave your story. Yeah. So today we're going to be talking about your pretty face. I know you had a little bit of filler recently, and it looks really good. Yeah. Are you happy with the filler?
I'm so happy with it. It's funny because I didn't know when we came in last time that you could put filler like in the nose area, because I would notice it. I'm on camera a lot, so that's when I really started to notice that like it wasn't as asymmetrical as I wanted. It kind of like swooped to the side a little bit, and I just didn't even know filler was an option. Obviously, I was like, it's not that big of a deal. I don't need like a full nose job, but I didn't think anything could actually fix that, so that was really cool.
Sure. I like to call it the Hollywood nose, and I think everybody needs a little filler in their nose. I mean, there are very few people that are perfect and symmetrical and look great. But the filler just tweaks it just a little bit, and it's just such a small amount in most people. So,
exactly.
So today we're doing a little Botox, and why do you do Botox? What do you like about Botox? I should say, not why do you use it, but what do you like about Botox?
I like that one is preventative because I don't feel like I've had like so many deep wrinkles yet, which is great. I don't really want them right now in my life, but I feel like when you see your makeup settle into those lines and you feel like you spend all this time getting ready, and then you just hate the outcome. It just is like, I actually like wearing less makeup, you know what I mean?
Yes.
So I really like enjoy that. I don't feel as uncomfortable. It's like as the day goes on, that it's going to settle all my makeup and the fine lines and stuff like that. So it just makes me feel better, you know what I mean?
Yeah. And your skin is so beautiful, and this is really one of my goals always is to get women and men to the point where they don't have to work with makeup. And so, I really think that that's what's great about the technology we have and the products that we have, because it really makes you look fresh and great without makeup.
Right.
So today we talked about just different areas that you might want to do Botox.
Yeah.
And you were mostly concerned about these lines here, you said.
Yeah, that's why I always had the issues.
Here, right? And then I suggest make the bunny lines for me, please. Especially those. I suggest we do that because over time those get deeper, and I don't really like that. And I just think smile hard for me, please. Just a little bit on the corners to just soften these. I don't want to do a lot of Botox because actually, if you do Botox too low, it can look weird and your cheeks don't go up. So I don't like that. So those are the areas we're going to work on today. You'll see this is really quick. Everybody knows Botox. Everybody loves Botox. So let's get started. And I need an alcohol wipe, please. I think I have them over here. Are they over there?
Oh, no, they're
They're over here. So we're just going to clean off the face. Now, some people say this is painful. Oftentimes we'll use a vibrator, but
I don't really ever experience any real pain from it.
Mm-hmm. I don't really either, and especially I just had it done recently and I used a vibrator and I was like, oh my god, this doesn't even hurt at all. So, and there is a little bit of bleeding and there's a risk of a bruise. So for those of you who are shocked that there could be a bruise, we're poking the face with a needle.
Right.
And every time we poke the skin with a needle, there's a risk you could get a bruise. And so now you can see we're just putting in little drops where she makes that bunny expression. Now we're going to do the crow's feet. We do it at the tail of the brow. Boom. Just a little drop. Another drop right at the, what we call the lateral canthus, which is the corner of the eye. Now we're going to do again at the tail of the brow, and then at the lateral canthus, and just underneath the skin. Now scrunch down hard. Now I love this. She's powerful, but she's her muscles only start about here, so we don't have to go very far out with the Botox. So we're going to go here and here, and here and here. And look at Bianca, she's a champ. Raise your eyebrows up high for me, please. And we don't have to worry about weird arching here because she doesn't have a lot of pull here. Some people will have a pull where it's like this, and we have to add a little Botox so we get rid of that sort of weird positioning of the brow. Now on the forehead, we're going to just do the center again because she doesn't have a lot of wrinkles. And I like to go high to make sure we don't drop the brow, because dropping the brow is something that women do not enjoy at all. And there we go. And then I have just a teeny little bit left, so I'm going to just put it in the chin because I hate puckery chins. And look, we've got just one little drop of blood. Go ahead and take a look at that. And see, it's not even a big deal. So you can hit a blood vessel and not even have a lot of bleeding. So there we go. And that is it. Bianca, I'm so glad you snuck out
I know.
to visit us today.
I had to.
Are you feeling great that the pandemic is sort of slowing down?
Oh my god,
a
I
little bit?
am. I'm feeling really good. I got my second shot, so I'm about to be fully vaccinated.
Yay.
And
Well,
I'm ready.
I can't wait for you to get out there and take off your mask and show off your pretty face.
I know. Thank
So
you guys.
thank you
are
for
the
coming in.
best.
It's always a treat to see you.
Thank you.